Have you recently suffered with severe pain in your arms or your legs because of a slip disc? Have you been suffering for quite some time with symptoms that are suggestive of a slip disc or a trapped nerve with pins and needles going down your arms or your legs? And has this been disturbing your sleep and your quality of life? If so, you might be having what we call as a disc prolapse and the associated clinical symptoms. My name is Dr. Deepak Ravindran and I am a pain management consultant, and I've been in practice for the last 10 years. Over this period of time in my pain clinic, I often see a number of patients who have started to have symptoms due to a slip disc, but by the time they come to the pain clinic, it's been years down the line. And the sad thing is, if they had come earlier, we might have been able to come up with a set of strategies. In fact, I'm sure we would have come up with a different set of strategies that would have given them a good quality of pain relief and recovery and restoring the quality of life. So you might ask, what is a pain consultant going to do different about a slip disc? After all, this is something that a surgeon might be needed, isn't it? And in most cases, a slip disc does not even need surgery. It can be managed well with the care of your GP and some good quality physiotherapy. But it is important because in some cases of a slip disc or a prolapsed disc, it's important to get in an intervention quicker and earlier so that you can prevent muscle spasm from persisting and making the pain more complex. And this is where a pain consultant makes a difference, because they have the ability and the skills to recognize when a treatment needs to be introduced, when interventions or stronger painkillers may need to be added at the right time to get a successful outcome. What are the treatment options then that are existing for slip disc? As I mentioned before, surgery is very rarely required. But before you even go down to that point of time, discussion with a pain consultant can mean you start with a new set of powerful painkillers. If that is not tolerated, we can look at getting emergency or urgent MRI scans, and based on that, you may be suitable for a nerve block either in the neck or in the lower back or even epidurals, and that combined with a very aggressive physiotherapy can result in excellent outcomes and good functional recovery. And these can be put in place by the pain consultant because most of them work with a good team consisting of physiotherapists and other complementary therapists. So what are you waiting for? Speak to your GP, see if you need to get a referral to your pain clinic or pain consultant for your slip disc problems. You may even need to or choose to go private if that is a quicker option in your area, and that is important to consider, because the faster you treat this and the quicker you use a multidisciplinary strategy, then the better the outcome and the faster the recovery and quality of life.